Knock, knock. Hi, Jane. My name is Cherie. I'm going to be your nurse today. I understand that you just had a baby a little bit ago, and today we're going to do a postpartum assessment on you to make sure we're not having any complications, okay? Hi, my name is Cherie. Today I'm going to show you guys how to do a postpartum assessment on a patient. Today we're actually going to use the method called bubble heat. It's a nice little mnemonic to remember when you are doing an assessment on a postpartum patient. So one thing that I do want to let you guys know is something that's not included in the bubble heat method is taking the vitals. So vitals on a postpartum patient are extremely important. It could be, you have to trend them so it can be a good indication of any complications such as a postpartum hemorrhage or signs of infection. All right, so Jane here just had a baby. We're always going to want to make sure we use our proper PPEs. So the first letter in the mnemonic is B. So we want to assess the patient's breasts. So we're actually going to ask Jane how her breasts are doing. So you're going to ask your patient, Jane, are you having any complications with your breasts at all? Any pain, swelling, tenderness? You're going to let her answer, and then we're actually going to examine. So a few things that we're going to look for when we're examining is we're going to look at the size, make sure that they're the same size bilaterally. We're not having one bigger than the other. We're also going to make sure that there's no redness or swelling going on. Something else that we're going to look at as well is the nipples. So a lot of times with breastfeeding moms, the nipples can get a little sensitive, so that's probably to be expected. But you're going to want to watch for bleeding, cracking, bruising, anything of that sort with the nipples, because that's not normal, especially for a breastfeeding patient. It can cause a lot of pain, discomfort, and that's usually a good indication too that there's something going wrong with there. So if you do notice anything, ask your patient, so how is breastfeeding going? Depending on her response and the way that her breast looks, you can always offer your assistance. So you want to make sure that you let them know. So Jane, next time that you are ready to breastfeed, just hit your call light and I'll come in and we're gonna assist you with that to make sure that baby's latching on, okay? Again, so that's just if she says that she's having any complications. So something else we're gonna look at is we're gonna look at if her nipples are inverted, exverted, or flattened, because that can make a difference too on how well the baby is latching. We're gonna look at the skin around her breast. We're gonna make sure that it's not red. Is it smooth? Is it soft? Has like a orange peel-like texture to it? Again, any abnormalities can be signs of an infection or improper breastfeeding. All right, so we're gonna cover you back up, Jane. So now the next letter is a U. We're gonna go to the uterus. So right after delivery with the postpartum, you always wanna check the fundus of the uterus. So we're gonna let our patient know because it can be quite uncomfortable. Jane, today we're gonna check your uterus. We're gonna make sure that it's staying firm and we're not having any excessive bleedings. So with the uterus, you can have a boggy uterus, which is a really soft and it increases your chance for hemorrhaging. So what we wanna do with a fundus check is let her know that it is gonna be uncomfortable. So Jane, this is going to be a little uncomfortable. So you're gonna take one hand, place it down in the pubic area for nice and support, and then you're gonna take your other hand and we're gonna feel for her, the top of her uterus, which is the fundus. So immediately after birth, it's usually about belly button or a little bit above. So depending too on what time of the day or what time you're checking for the fundus, will depend on the location of it. So we always want it midline and we want it to make sure that it's firm. So we're gonna go ahead and let her know that it's uncomfortable, and then we're gonna push nice and firm, and we're gonna be feeling for that fundus. So when it comes to documentation, also you want to note where your finger is. Anything below the belly button is obviously one finger below. Make sure we document that it's midline. Some things that are important too, if it isn't midline, is to make sure she goes to the bathroom. A distended bladder can affect that. And then also you If the fundus isn't firm, you want to make sure that you massage it and check for or continue to massage it until it gets nice and firm, because we want a firm fundus. So next thing we're going to do is we're actually going to assess her bowel sounds. So a patient postpartum should always have regular bowel sounds unless they get general anesthesia, which isn't all that common. So a general anesthesia, you might hear hypoactive, but you want to make sure that all of her bowels are good to go and are active. So this might be a little cold. So we're going to assess all 4 quadrants, listening for that bubbliness. All right, perfect. So all of her bowel sounds are active. And then next thing we're going to want to do is we're going to talk to her about her bladder. So we want to make sure that she's using the restroom. First, like I said earlier, an overdistended bladder can affect the fundus. It can make it shift either direction. So Jane, when's the last time you used the restroom? Make sure that she's going. Patients that are postpartum tend to forget that they actually have to go to the bathroom, and then they tend to hold it, and that puts you at risk for other things such as a UTI or an infection of some sort. So the next thing we want to check is her lochia, which is the bleeding after delivery. Again, we're going to expose her, let her know that Jane, we do have to check for bleeding. We got to make sure that we're not having excessive amounts or clots. So we want to check the color of the lochia. We also want to check for any blood clots at that time, and also any unusual foul smelling odors. Some small blood clots are okay. We want to be looking for anything bigger than a quarter size. Anything a golf ball size would be obviously concerning. Lots of blood is concerning. So we're going to go ahead and we're going to check. And then we're also going to ask them when's the last time they changed their peri pad. So Jane, when's the last time that you checked your peri pad? 20 minutes ago? Okay, great. So she has little blood and no clots, so that's perfect. Another thing that while we're down there that you want to check, which is the E, is an episiotomy. So if they had an episiotomy, you want to make sure that there's no bruising, no swelling, that the stitches are still acclimated, and then make sure that there's no complications with that as well. So we're going to go ahead and cover her back up, and then we're going to move down to her legs because we want to assess for DVTs. So the next thing is called the Homan sign. So the Homan sign isn't a for sure sign that there is any blood clots or a DVT going on in their lower extremities. It's just one diagnostic tool that we can test as well. Something that we're going to definitely want to look at is if she has any swelling, pain, any redness, and make sure that you ask her. So Jane, are you having any complications with your legs? Any pain or swelling today? No? Okay. So her skin color looks good, so we don't have to worry about that. So now with the Homan signs, we want to just kind of assist with the leg. And all we're going to do is flex the foot. And we're going to release it nice and slow. And we're going to see if, watch for any signs of pain going on. So you also want to check that on both legs. Perfect. So no pain at all. All right, great, Jane. So the other thing we're going to want to do is we're going to want to check for pedal pulses. Make sure that they're present bilaterally. Great. All right, so pedal pulses are present. No signs of any DVTs. We'll cover it back up. The last thing that we're going to assess is her emotional status. So Jane, how are you feeling? Are you feeling any thoughts of sadness, any overwhelming feelings? We want to make sure that we're there to support our patient. We want to make sure that we give her the resources, the tools to accommodate to having a new baby, a newborn. Sometimes it can be very stressful, especially if you have another child already. It can be very scary as well, especially if it's your first child or if there was a little bit of complications during the birth. So we want to make sure that we're really there for our patient. And then also before, just make sure that she doesn't need anything. Jane, is there anything else I can get for you? No? Okay, perfect. So our patient looks great. So we have no issues with our breastfeeding is going good. We have no issues with her fundus. She has appropriate amount of blood, no issues of DVTs. All of her vitals are stable at this time. She's alert and oriented, answering all my questions appropriately. So, all right, Jane, I'll let you enjoy your new baby, and we'll see you in a little bit.